introduce Cindi Mrotek. I hope I'm saying that right.
Close enough. Yep.
She is a certified special education teacher and board certified assistant behavior analyst. So that's a BCABA. Cindi is the CEO and founder of ACE Behavior Solutions. ACE Behavior Solutions focuses on doing what matters for individuals with disabilities. She has 18 years experience in developing programs and interventions for individuals with autism and other developmental disabilities in both the public and private sectors. Cindi has extensive experience coaching and training staff on behavior interventions, development of behavior intervention plans, and supporting the IEP process, which many of us on this conference are very well aware of and have love of our ABA folks who help us get through our BCBAs, get through that process. Additionally, Cindi has worked with educational attorneys for both families and districts to ensure that free and appropriate public education is available to those that are entitled. So with that, it is my pleasure to turn it over to Dr. Cindi Mrotek, and your co-presenter today. I'm going to let you introduce, and we are ready to take some notes and learn.
All right. Thanks for having us. First of all, I'm not a doctor, but I like to pretend I am.
I just promoted you unofficially. So
I know I don't want to misrepresent, but I want to thank the Borello family for reaching out to me and asking me to give this presentation. Love working with the family, and Hannah's made some great progress with us. So thank you for extending the invite. I'm co-presenting with my clinical director here. Her name is Kim Malloy. She's a BCBA and special education teacher as well. We have similar backgrounds, so we always usually tag team this presentation. So I thought it would be great to kind of bring her along for this journey. So I'm going to share my screen and we can get started. So the title of our presentation is Little Skills, Big Gains, the importance of direct teaching of skills. We know in life, but specifically our clients and kiddos that need ABA therapy, we need to break skills down into smaller steps and directly teach them so they can be generalized and implemented in the natural environment. So all of these little skills that we really break down lead to a bigger picture and greater independence. Our agenda is we're going to go over what ABA therapy is, some common misconceptions about it, why some of our clients require direct teaching of skills, and how we program for our clients, which we really focus on essential skills and using the essentials for living assessment and teaching. And we may not get to this part, but we'll talk about skill acquisition and transitioning into the natural environment. So what is ABA and some common misconceptions? I'm going to let Kim take over this part of it.
All right, so getting into what is ABA, what does it stand for, what does it mean? Well, in a nutshell, ABA stands for Applied Behavior Analysis. In the field, we say ABA for short. We love acronyms in special education. No difference here. But ABA refers to human behavior and how people learn. It focuses in on increasing socially significant skills by providing consequences that will either increase or decrease a behavior. And again, in ABA, we really like to focus in on those socially significant skills. What skills directly impact our clients' lives? So when we think about ABA, we think of it in terms of a contingency. So S stands for stimulus, R stands for response, or ABC, antecedent behavior consequence. And I'll get into the terms a little bit more in a second. But going back to what I had said in the previous slide, ABA looks at the environment. How does the client interact with the world around them? We're always receiving information or stimuli. So in ABA, we manipulate the variables, either the stimuluses before a response or after a response. So we talk about that in ABA is antecedent, behavior, and consequence. So antecedent simply means what happens right before an observable behavior. A behavior is, and people get hung up on the word behavior in our world. Behavior is just behavior. Behavior is anything a dead man can't do. We love the dead man test. So it can be a positive or negative behavior. We're sometimes looking at increasing appropriate behaviors, sitting in a chair, raising your hand when it's your turn, asking for permission to leave the room. On the flip side of the coin, sometimes we're tracking the not so great behaviors, kids that tantrum when they can't communicate their desires or what they need. Consequence, again, in scientific speaking terms, people think consequence is, oh, somebody did something, they received a consequence, they're going to go sit in the timeout chair. That's not what it means in ABA. Consequence just means what happens directly after the behavior. And in ABA, we are extremely interested in antecedents and consequences because we are looking at what could possibly be driving this client's behavior. Is it something that happens right before? So an example, maybe a client requests for a cookie and they're told no and they drop to the floor and cry. That could be driving a client's behavior. Sometimes the consequences, so in this example, client wants a cookie, client doesn't have the language, client drops to the floor, starts screaming and crying. The adult hands them the cookie to stop the tantrum. So what has happened now is that behavior has been strengthened through the consequences. The consequences had a direct play in, well, now every time I want a cookie, I might fall to the ground and tantrum to get said cookie. So some of the consequences that influence the behavior, there's positive and negative reinforcement. So positive reinforcement means adding something to the environment with the likelihood that the behavior is going to increase in the future. Negative reinforcement is removing something from the environment that will most likely increase the behavior in the future. There's also punishment. There's positive punishment where you add something to the environment immediately after behavior that will decrease the behavior in the future. And there's also negative punishment, removing something from the environment immediately after behavior that will most likely decrease that behavior in the future. So this is just a short little clip. I'm not going to play the whole thing in interest of time, but this is, I think, how a lot of people traditionally see positive reinforcement. That's not how we do things here, but I think it gives a little funny explanation of increasing somebody's behavior through positive reinforcement.
Are you finished?
Well, thank you. How thoughtful. Would you like a chocolate?
Yeah, sure. Thanks. Oh, sorry, Sheldon. I almost sat in your spot.
Did you? I didn't notice. Have a chocolate.
Thank you.
You're here a lot now.
Oh, am I talking too much? I'm sorry.
Thank you. Chocolate?
Yes, please. Oh, hey, Kim. Yeah. You know what? Hold on. Let me take this in the hall.
So I'm going to stop the clip there, but this is just a comical, funny way. Sheldon was trying to, and I'm sorry, I don't watch Big Bang Theory, so I don't know what the blonde's name is. Penny? Okay, thank you, co-presenter. Penny. This is why we present together.
That's right.
Sheldon is trying to shape Penny's appropriate behavior because he finds her kind of annoying. So he used positive reinforcement, meaning he added something to the environment. He added chocolate with the hopes of Penny would decrease some of her annoying behavior. So we saw that She started talking too much. Sheldon looked. She said, "Oh, I'll zip it." And he said, "Here's a chocolate." That shows the example of manipulating a consequence. Oh,
Are you?
well, I'm sorry about that.
So I'll take over. Here's some common misconceptions about ABA, and then I'm just going to get into how we do things a little bit differently at ACE Therapies. So a lot of you may have heard that ABA is just for children and adults with autism. We know that ABA is just the science of behavior. It works on everybody. You go to work to get a paycheck. You wouldn't go to work if you weren't getting a paycheck. You answer the phone when you hear it ringing. You don't answer the phone if you don't hear it ringing. Those are principles of behavior and science. ABA is reserved only at the table. Meaning that it's just teaching kids to sit at a table and you give them a bunch of flashcards. ABA produces little robots. We do not do that type of ABA at ACE Therapies. We don't believe that that is best practice at all. We don't own flashcards in our clinics, especially for our older clients, our adults. We want them to be learning in the natural environment. Most of the clients we service and clients that we service with developmental disabilities that are not autism, they don't need to know 12 different pictures of a spoon. They need to go to the kitchen and get a spoon and figure out how to use it. So we're teaching and constantly reinforcing in the natural environment. You may have heard that it utilizes adverse procedures to obtain compliance, such as saying no really loudly or putting in punishment. We use natural reinforcement and natural motivation to increase behaviors we would like to see more on. And the last one, which kind of goes with the clip, that, we use bribery, to get clients to do what we want. We know that bribery or giving a Skittle or a goldfish cracker, that does not produce long-term meaningful change. So we just use natural positive reinforcement that's in the environment, because as parents, you're not carrying around a token board and giving stickers for everything, your child may do. So we just focus more on what's naturalistic and everyday. So in contemporary ABA, which is what we focus on, like I really pointed out, we use a lot of natural environment. We want our learners to be participants in their therapy, meaning they're coming to me and I want them to think it's Disney World when they're walking through the therapy door, that their therapist is the best person in the world. When you're an active participant in your therapy, we see change and results quicker. We focus on quality ABA, which focuses on three things for us. Is it televisable? Meaning, could I, broadcast it and everybody would think we're giving quality therapy? Are we safe? And we really focus on rapport with our clients. We want them to think we're great. We think all of our clients are great walking through the door. And if something is not right, we make a change. So we really focus on direct teaching of skills. We found that a lot of our clients need to learn smaller steps to lead to a bigger gain in life. This includes life skills, communication skills, social skills. So for an example, if we're working on brushing teeth independently and, our clients have a hard time or an adverse reaction to brushing teeth, we might just start out with holding the toothbrush for 10 seconds. And then after that's mastered, we might then start with putting toothpaste on the toothbrush. So we break things down so systematically that the skill doesn't become aversive, and we reinforce that skill positively somehow with what a client finds reinforcing or motivating. We also know that most of our clients that are accessing ABA therapy, they're not learning naturally from their environment, meaning they're not looking around and scanning the room to see what they need to be doing. If I'm at a yoga class, for an example, and I'm not paying attention, I can scan the environment and kind of figure out what I'm supposed to be doing and imitate that. But we know that the clients who access ABA therapy need to learn to scan the environment to begin to imitate skills, which is why we systematically use direct teaching and eventually transfer it to a more naturalistic environment. We also work on modifying the environment to make the lives easier for our clients. What's the most efficient, simple way to do things? So instead of measuring laundry detergent, we teach our clients to use, those little pods. Instead of maybe accessing the stove for cooking, how can they independently use a microwave? Instead of tying shoes, are there slip-on shoes they can put on? We pre-organize sets of clothes. So the first thing we do before we directly teach is how can we just make the environment more efficient and easier and teach that skill to fluency or independence. We follow at ACE Therapy a program called Essentials for Living. And the Essentials for Living focuses on essential 8 skills. Those essential 8 skills are listed here. It's making requests, waiting, accepting the removals of preferred items, sharing, taking turns, making positive transitions, completing tasks, following directions for activities of daily living, and directions related to health and safety, tolerating health situations. We really focused on tolerating masks during COVID. And the reason we use these essential skills and the essentials for living is a lot of assessments in applied behavior analysis world focuses on skills that typical 4-year-olds would have or typical 5-year-olds should have, and neurotypical in quotes. If we're servicing a 12-year-old and they don't have those skills that a neurotypical 4-year-old should have, I don't want to waste anybody's time anymore. We need to transition to a program and a plan that will lead to greater independence in life, such as completing showering routines, completing simple tasks around the house. So this really drives all of our programming. And this is a quick video on the Essentials for Living.
Many children and adults with moderate to severe disabilities, including but not limited to autism, struggle to learn functional skills such as communication, daily living, and tolerating skills, skills that will matter in their adult lives. Essential for Living is a comprehensive curriculum, assessment, skill tracking instrument, and practitioner handbook designed to help teachers, speech-language pathologists, and behavior analysts teach functional skills and manage problem behavior. EFL includes 3,000 skills and focuses on the essential 8 skills that are necessary for effective adult living. These include expressing your needs and wants, waiting, accepting no, transitioning, responding as a listener, tolerating commonly occurring situations, and avoiding hazardous ones. EFL also focuses on communication and language skills by helping those who are nonverbal find an effective alternative method of speaking that lasts a lifetime. The communication, language, and functional academic skills in EFL are also linked to the Common Core state standards. EFL is more than just a list of skills. It's when and how to teach those skills. And it's how to track small increments of learner progress often experienced by learners, especially those with severe handicaps. Join the ranks of school districts, private schools, ABA programs, and supported living communities that are effectively using Essential for Living to improve the lives of their students and residents. Visit our website to learn more about Essential for Living. Then give EFL 2 weeks and get a curriculum for a lifetime.
So we focus on the essential 8, like I said, at ACE Therapies for all of our clients. And that starts at age 2 all the way up to age 26, because we know that we need to teach these skills early in life. And that's how we program for ABA at ACE Therapies. We don't just start working on waiting and working on tolerating health and safety procedures when you're 16 years old because your public school says you need a transition plan. We start focusing on these skills at age 2, at age 3, because we know it could take a very long time to complete activities of daily living, to master those skills. We also focus on, I'm going to skip ahead just because I'm being cognizant of the time. let me backtrack. I want to make sure I'm hitting everybody in the audience, age groups. So we focus on these essential skills because we know that adulthood really begins at age 3, not at age 18, right? We need to teach skills early in life so we have successful adults that can live independently or with, a modified supported living arrangement when they're 26 years old. There aren't, as many of you know in the audience, when you get to an adulthood, there are not one-on-one supports. So we need to start working on essential skills early so they can respond in a group setting. They can follow directions if they're working in a group of 4 or 5 people. So in our philosophy of ABA is, number one, to work ourselves out of a job. So, they can go on and have a successful life, and that we program for skills that matter early in life, that there's an effective way of communication, there's an effective way of advocacy for themselves. They can complete activities of daily living skills, showering, making simple snacks, dressing themselves as independently as possible. So where we begin after the essentials for living, after we do that assessment, is we start to write treatment plans and goals. So what that looks like for us, and these are some examples of goals that we would program for our clients, is that a client will wait within arm's length of an adult when directed to do so, at least 10 times a session. So when we ask one of our clients to wait, we expect them to stop in a certain position without leaving an area. We also want our clients to indicate interest in an item when a choice is presented. We make sure to write all of our goals. As you can see, there's not a percentage to anything because we want our goals mastered to fluency. Fluency meaning that they can demonstrate that skill 100% of the time with accuracy, no matter who they're with. So you're not going to see goals, and I would encourage everybody in the audience right now, if a child needs a prompt to complete a task, it is not mastered. If a child requires, extra support, it is not mastered. For us, we want fluency because we know then that skill is 100% mastered and can be done independently. So some of the self-help skills that we work on, but not limited to, we work on dressing, grooming, morning and bedtime routines, meal prep, scheduling the day, hygiene routines, requesting and accepting help, or if they're given corrective feedback, meaning there won't be a tantrum or a maladaptive behavior if we say you need to wait. No, there's a change in schedule, because we also want to teach flexibility, because look at the past year and a half with COVID, we all had to learn to be flexible, and this time was hardest for our individuals with developmental disabilities because of all the changes and learning how to be flexible. So we teach flexibility right from the beginning when people come to our center. So this is just an example of one of our clients, and we had permission to use her picture. Setting the table, we expect them to open up the cabinet by themselves, grab the plate, and then bring it to the table. And some of the precursor skills we're always looking at are, can our clients follow directions? Can they work independently? How well can they tolerate skills? Are they flexible to changes? Can they follow a schedule, whether it's written down or if it's visual? So when you're looking at any program, and this isn't just an ABA, I would encourage you to look at this in an IEP as well. And I know there's IEP sessions. Use the results of assessments and the family goals and what are the current skills to target those barriers to prioritize skills. So what's your end goal basically for your child? And let's work backwards to prioritize how we're going to meet those goals. Let's determine, the level of independence in the areas of language, social skills, and leisure skills, and how can we get it to the next level to get complete independence. We obviously want to meet the child or adult where they're at. So this is why we really need to understand their current level of independence and any barriers that are getting in the way of getting to independence. we want to break down big skills into much smaller steps, right? We call those in the ABA world behavioral cusps. So what little skills do they need to grow to something larger, right? So if, for an example, if we want our clients to read, we're not just going to, give them a book to read. We might have to break it down to sight words or letters or find books that they're really interested in. So breaking down those big skills into smaller steps. And then we're always looking at programming for generalization in the natural environment. So if we need to teach that skill directly at a table or in a room, how are we going to bring it into where they live? Because that's where they need to demonstrate the skill the most. Or how are we going to demonstrate and generalize that skill in the community? And this is just about prompting, and I don't mind sharing this presentation with people. But like I said, a prompt is a stimulus that's given with a direction to increase appropriate responding. So, we might tap something, we might do hand over hand, we might use a visual, but it's our goal to take away all prompts. And, why do we teach these functional skills? We want to increase independent functioning. That's our number one goal in ABA. It also makes our clients feel better when they can demonstrate skills independently. And we want all of our clients to be employable, right? So they need to be able to take directions from other people. They need to be able to demonstrate skills independently to be employable. So our end goal is always independence. And this is just our contact information, but I'll put that in the chat box. I want to be cognizant to answer any questions. So that leaves about 10 minutes.
Yeah, I've got a couple here. I'll jump in and kind of facilitate from the chat first. And then if anybody has anything following that, you want to prepare to take your mic off mute, we can do some of that as well. So there was one that Natalia asked that I actually pinned because I wanted to make sure I did a really good question, and you might be able to offer some insights for us. And it's, how do we tell quickly whether a provider, what are a provider's real philosophy and practices, as opposed to kind of using sort of the typical or, socially acceptable definition of ABA, or the kind of a generic version of what ABA is. If you want to really understand, if you're shopping for a provider and trying to find the right ABA team for your loved one, what's a good way for us to kind of understand if they think like you, or if they think like, what school of thought they're part of?
I think parents can find out pretty quickly when they talk to a provider. I'm very transparent right away. I tell them, if you're looking for a stack of flashcards, if you're looking for a token board system, you're not going to get that here. I would ask what kind of assessments that they use. That would be a number one question. Again, we do use, for our little itty bitty clients that come in, we do use more developmental curriculum, but we know and I think this is key for parents, adaptive skills always trump academic skills. And that's the same for any neurotypical person, right? So neurotypical people, if you're super smart, but you don't have adaptive skills, you're not going to maintain a job very well, most likely. So we always say adaptive skills are more important than academic skills. So I would ask an ABA provider what their philosophy is on that and how they track progress.
Right.
And again, it's dependent on the families. Maybe it is important to you that they know 700 flashcards. I don't know, but that's just not our philosophy.
Right. I actually had never heard of EFL before. So for me, that was a takeaway and something that I might use when I'm talking to potential therapists for my daughter, just to kind of, see what kind of exposure they have to different tool sets and assessment types out there. Yes. I really like the way that you framed that. So,
and the co-author of that assessment, his name is Troy Fry. He's our clinical consultant. So he trains us a lot on the essentials for living and how it looks and how it should be implemented. And it's a great assessment tool. It really does focus on all of those essential skills and kind of puts things in a framework that, oh gosh, they are 4 years old and they don't know how to wait. I need to focus on that a little bit more, instead of just, And I'm sure you guys have seen terrible IEP goals. I was part of a school. I wrote terrible IEP goals. You know, I don't want a 5 or 6 year old to be filling in the blanks to Mary had a little and they fill in lamb. I want them to be able to say coffee, water, I need a break. So just what's important? That's what I would be asking. Like, these are my goals for my child or my adult. And how can you help me get there? And how are you going to track progress?
Great. That's a good segue, what you just mentioned there. There seems to be some growing interest from a couple of our attendees around the applicability of ABA for adults. You'd mentioned along somewhere in this presentation, the age 26 would be kind of, I don't know if that's an evidence-based best practice that you can't do things with ABA after that, or where that comes from. But there are some parents on here that are looking for resources for their young adult children. And talk to us a little bit about how and when these types of therapies can be useful for folks that maybe entered this, this domain late in life, like my daughter did. She didn't have the benefit of ABA as a child. So that 26 number comes from insurance funding. So insurance basically stops funding it. Most insurances stop funding ABA at around age 26. But we have clients, we service a client who's 25 right now. So we service 2 to 26. We have clients that just started ABA with us, at 17 years old, basically because they couldn't find a good provider. It focused kind of on stuff that wasn't important to families. Or they know that, oh my gosh, one of our clients, the family's just like, the old ABA didn't work for my now 15 or 16-year-old. We need to focus on essential skills. But we focus on essential skills right away. I see a question like, is EFL before age 26? Yes, we focus on it at 2.5. So Great. It's just the curriculum to kind of take you through the lifetime. Right. And then one of our moms has actually a scenario that I think I'll read it out to you. And I think what we're looking for here is, is this the sort of thing that ABA can help with? So she says Lillian absolutely refuses to wash her hands. And I believe that Lillian is 19, if I'm not mistaken, Camilla. So she absolutely refuses to wash her hands. It's something new that she used to wash her hands, but she's been refusing for about a year now. And so the only time that her hands get clean is when she takes a shower. She won't substitute with anything like hand sanitizer. Is this the kind of a life skill, is a grooming, clean, hygiene that ABA can help, mitigate or improve an outcome with?
Yeah. So we would just break that down into really small steps. So if she's refusing to wash her hands, it might be just stand at a sink for 5 seconds and walk away. Then maybe it would be just turn on the water. And after that's mastered, we'll go to the next step of putting your hands under. So we would just use those concepts of motivation, reinforcement, and breaking it down into like a very small task analysis to increase independence in hand washing. That is, and I didn't explain this and they didn't explain this in the EFL video, but the assessment is broken down into must-have skills, should-have skills, nice-to-have skills, and don't need skills, depending on how they score. So washing your hands is a must-have skill. So we would always focus on the must-have skills right away, and then, work our way through the assessment. There are some of our kids, like one of the nice-to-have skills is, ordering, an Uber. I'm making that up. But there are some skills that we know some of our clients are never going to need to have because they're never going to be put in a situation like that. So we always focus on must-have skills, and washing hands would be one of them.
Great. Liz has a question for you. Do you ever try to ask what could be motivating a factor for a behavior? I know that not everyone can answer this, but it is helpful if you know what is driving a behavior.
Yeah, so our rule of thumb, Liz, is we never try to change a behavior until we understand it. So, we back off and we say, hey, we're going to observe, we're going to see what is reinforcing this behavior. Is it something that's happening before? Is it something that's happening after, is it a skill deficit, right? We know a lot of behaviors increase when they're missing a skill, and that's something we need to teach them. So those are questions we ask right away. Is this a can't do, or is it a won't do? Meaning they have the skill, but they're just refusing to show me that they know how to do it. Or do I need to teach it? Why is the behavior happening? Because if I try to change the behavior for the wrong reasons, I'm just going to have more problems. So we just like to take our time and solve the mystery, because, you know, there's sometimes like, oh my gosh, where is this coming from? Like, I need to figure this out. So, you know, we think that like that as behavior analysts as much as parents do sometimes. Like, did this come out of nowhere? I'm supposed to know what to do in this situation. So that's why we just kind of like slow down and put our minds together.
It's detective work sometimes.
Yeah.
Right. Great. We have another question from a mom, Christine, who has a 9-year-old ring 18 daughter who has limited speech, and she's getting speech therapy services and ABA. How do the two go concurrently? Is there any overlap?
Yeah. So for insurance purposes, Christine, I'm not sure if you knew this. This is just education for parents. We have to have coordination of care. So that's like mandated for us to get funded. So we do work with speech paths. You know, we might meet once a month with the speech path to talk for 15 or 20 minutes. You know, the speech paths that we work well with in ABA, and I think speech paths and BCBA sometimes go like this, because, you know, sometimes they think they can teach them how to talk. I'm not saying I can teach the mechanics of the mouth. I can't, but we can teach functional language. So for us, the function of the language is more important than the form, right? So I don't care if it's a sign, a picture, you know, gesture that, you know, a handful of people know what that means, but is that language functional? So as long as you're working together with your speech path to make sure that it's functional to get a need met, I think it's a perfect marriage.
Yeah, that sounds great. And Christina is tuning in all the way from Kenya. So her healthcare system may be a little bit different in terms of what insurance constraints or supports that she has, but it does sound like that the two modalities can be complementary as long as the providers are collaborating.
Yes.
Right. Any general advice on using consequences, the positive, negative versus negative reinforcements?
You know, well, we're all about positive reinforcement, right? Like we try to avoid punishment procedures at all costs. And if any ABA provider or any teacher, whoever you're dealing with, uses a punishment procedure, the positive reinforcement needs to be 100 times stronger than the punishment. So always make sure you have a great, you know, tool bag of positive reinforcement. There is a place for punishment procedures, but we're more about positive reinforcement. Negative reinforcement isn't necessarily a bad thing. It depends on what you want to change. So I don't have exact feedback on positive and negative reinforcement because I know it's so situational, but you know, I would definitely just say your positive reinforcement always needs to outweigh anything negative or any sort of punishment procedure.
It's the 80-20 model.
Yeah, the 80-20 model. So 80% completely positive and has to override any sort of corrective procedure. Right.
Yeah, Kathy's actually commenting too, who I know you know their family intimately, that Hannah's still getting some of her standard therapies, you know, OT, PT, speech through the school. And so the collaboration or the overlap with what you guys are doing actually fits nicely. So that's encouraging to hear. And there are some comments over here in the chat too about how to find ABA services. First thing that come to mind, I think, you know, a lot of us may be involved in you know, with developmental disabilities in our state, those case managers can often refer. Sometimes the school will know great ABA or have ABA on board. What other advice do you have for us we're looking for ABA or BCBAs in our area that could have you know, an impact for some of us that need help?
You know, unfortunately, ABA therapy is really, you know, advertised towards that autism diagnosis, right? Because that's what covers the insurance covers. So Autism Speaks, and I know this is not an autism conference, but Autism Speaks has a huge list of very good ABA providers in your area. You can put in your zip code and, a bunch will come up. I think one word of warning I think I would have for parents are these big box ABA companies like, Autism Home Supports. I don't know this for a fact, but that's just a big name ABA company. They focus on checking boxes a lot, bigger box ABA companies, right? So you need to find a company that is smaller and intimate and doesn't have a bunch of business mandates they have to check the box off of, right? So I think it's a good balance. That's just something that consumers need to be aware of, that very large companies, because they're a corporation, they have different philosophies possibly than smaller ones.
Great. Well, we are at the time limit for our session, guys. So I think if I did my job, I think I caught most of the big hitters over there in the chat with the questions. For anybody that wants to drop any other questions in the chat, we'll try to capture them. And then if we have anything lingering, Cindi, we might send them over and ask you to just do some written Q&A for us, and we can get them out to our families after the fact. So everybody, we have about a 15-minute break before the next series of sessions that will come up at the top of the hour. And so if you can make your way back to your session schedules and pick one of the 3 sessions that are coming up next, we will convene for this one, and we will see you guys all back on in 15 minutes. Thank you so much.
Thanks for sharing information with everybody. All right.
Yes, very important. Thank you for contributing. Bye-bye.
Bye-bye.